your nursing diagnosis here is safety most of the time. Pharmacology treatments are your anticonvulsives, and remember, those are the ones with the side effects that just help relieve pain. So this is like your amitriptyline sometimes are given here. Your analgesics and anesthetics, your narcotics, and your nerve pain meds. So here are your like gabapentin, your Lyrica, things like this. Non-pharmacology management, you're going to be looking at your TENS unit, gentle exercise. Now I underline the word gentle here. Think about what is going on. You have decreased sensation, you may have pain and burning, and we want you to not lose function of your limb or your affected body part, but we don't want to put so much pressure during exercise that we can damage it further. So we would not suggest going out and running a marathon, okay, or running a 5K or even a 2K, but you know, trying to get in 100 steps each time may be okay. But we don't want to do something that's going to jar your joints or jar your body parts, okay? And then the client teaching here is the daily inspections of feet. And remember, this is where we talked about in class that you can use a mirror to see the bottom part of your feet if the patient can't bend it up to look at it. Good foot care, if you want to make sure that you wash it, dry it well, and then moisturize it so that you can keep the skin intact. That's our whole purpose. And then change the modifiable risk factors. Do not walk barefoot, that's a biggie. No prolonged sitting with knees bent. And why do we do that? Why do we say that? Circulation. If our knees are bent, we have a crook in it, then it's not getting good circulation back up to the heart. And then control chronic conditions. That's your high blood pressure, your diabetes, things like that. Questions about peripheral neuropathy? Okay. Now let's talk about some of the heart stuff. Okay. So atherosclerosis, again, this is one of the things that Ms. Lell taught. So here we have where we start off with the vessel damage, it becomes inflamed, and then the vessels harden, the plaque formations start to form, eventually one breaks off or ruptures, and that's where we have the clot or occlusion. And so here are your risk factors listed. You'll see a bunch of the same ones we've talked about before. Hypertension, high cholesterol, diabetes, smoking, obesity, sedentary lifestyle, and family history. Which one of those can we change? Which are modifiable? Obesity, sedentary life, smoking, diabetes, and not that we can cure it, but we can what? Manage it. Same thing with high cholesterol and hypertension. Signs and symptoms, sometimes there's no early signs and symptoms until some serious narrowing has occurred. And so if we have serious narrowing in the coronary vessels, we're going to see things like chest pain, shortness of breath. In the carotids, which are up in the neck, we're going to see weakness, a headache, dizziness, vision changes, and speech. Think about, you know, if we have occluded vessels here in the neck, then we should see things here in the head area that's going to be affected. And then in the peripheral vessels, so like your lower extremities, your arms, you're going to see like a DVT here is going to cause some pain, and it's going to cause some gait changes if it's in your lower extremities, or maybe even some functional loss up here in your upper arms. Okay? Your treatments and meds, statins, aspirin, control the risk, which are right here, lifestyle changes, and then we can also do things like a heart cath. If there is something that we need to get rid of, a clot we need to get rid of, or a CABG, which is our open heart